Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician hosts, Dr. Tom McGovern
and Dr. Andrew Mullally, where we and our guests discuss relevant and health-related topics from an authentically Catholic perspective. Dr. Doctor is brought to you in part by the generous underwriting of CMF Curo. Learn more at mycatholichealthcare.org and live your Catholic faith in your healthcare with CMF Curo.
Today, our guest will be heard across the EWTN Global Catholic Radio Network. Joining us will be lawyer Louis Brown, returning to the good show itself. And he's executive director of our sponsor, CMF Curo. And he's an attorney who advocates for Christ-centered healthcare. So he's working in the public arena with policy, and he's also working with a product where they offer health sharing. And they've started something new, and that is health wellness. And it'll be interesting to talk to him about why they decided to do this and what the evidence is there for some of these things for helping us to stay healthy. Because I think as Americans, compared to many other countries, we're not so good at staying healthy, are we, Andrew?
No, America is, we all have our strengths, and America's got many, but that's not one of them. It's not. And part of it's because we're so, I think, technologically advanced. I mean, that leads to sedentary lifestyle and poor health in general.
Sad, but true. So now we have to be more attentive than maybe in previous generations. I was just reminded because last week I was at a conference with 17,000 young people. And I think I dropped a few pounds just because I had to do so much walking. And in European countries where they do a lot of walking, I think that in itself takes care of many different health-related issues.
Yeah, 100%. People who are accustomed, people living in the city and they might not have a car. I mean, most Americans, I'd say, at least most of the people I know, they live somewhat away from their work. They're driving to work, parking close, sitting at a desk for a lot of the day. It's just you don't have the opportunity. And so I'm excited to hear what Louis is doing there. And it's an interesting angle, especially with health insurance, trying to focus on the wellness. Because, one of the big shakeups with health insurance that I've kind of been following is after the start of Obamacare, they got rid of the pre-existing condition bit. So you can't classify folks as a good insurance risk or a bad insurance risk. Kind of very different from car insurance. If somebody gets in wrecks all the time, they're going to be paying more than somebody who's a good driver. And same thing for life insurance. There's risk stratification, and people pay more if they're more likely to be paid out on as an insurance policy. So in health insurance, we don't have that. They can't do that anymore. And so now everybody's paying like they've got all these medical conditions and stuff. So for an insurance provider, I guess, the more they can focus on wellness, saves money in the long run, keeps premiums down, which is really good.
That is really good. And I'm curious how many people do that. I remember like 10 years ago, I went and lost 30 pounds. And only after I lost it did I find out I could have gotten money back from my health insurance company. But I didn't know it until afterwards, and it didn't count.
Yeah, I think that many companies, insurance companies, have things like that. If you quit smoking, then, I don't know, they'll send you a free gift card or something like that. And I remember there were some times, especially in residency, when I would see a lot of patients on the Medicaid insurances, they would get a gift card to come in for an office visit, and it was more than the residency was getting paid to see them. But these are the types of things that you have to do to get people to do what is going to make them most healthy. Because I think that's another interesting aspect of health insurance, actually. There's so often when I'm seeing patients, they're like, I don't really care to do all these check boxes and questionnaires and stuff. The thing that patients don't appreciate, though, is that the insurance companies refuse to pay us for the services rendered or withhold part of it if we don't ask, do you want to do a colonoscopy? You're due for one. Nobody's excited about it. And even if ultimately you don't want to do it, that's okay. That's your prerogative. But my job is to offer it so that what's available. And the insurance company forces my hand, because if we don't talk about it, and then heaven forbid you get colon cancer, they're really mad at me that we didn't do something to prevent that.
Yes. It's hard to win sometimes, isn't it?
Well, it's so convoluted, and it leads to frustration. On on the part of patients and on the part of healthcare professionals. I know I'm frustrated with insurance routinely. It's an easy target, and it doesn't seem to care. No matter how mad I get, it's still there. So yeah, it's tough. So hopefully, Lewis can help unravel some of the
I
issues.
wish we didn't have this middleman paying. I mean, just about everything else, you pay for what you get, but it's not true in medicine, and it just separates us so much. We're atomized as a society, and I can't believe that's good for healthcare.
Well, it's I can't think there's that many jobs where you do the work and then you figure out what it's worth later, and it's not up to you. The prices you set are totally fictitious. It doesn't really matter what you set because the insurance company is going to tell you later what your work was worth.
Yes, and even if we have to pay our staff more, we can't raise prices because it's whatever the insurance companies pay us, and
Yeah.
it yeah, it's not fun to feel like even though you're in private practice, let alone half of physicians who are not, you still aren't really in control of your practice.
It's interesting. I was reading an article about the new Medicare cuts because last year they cut like 0.75% in reimbursements to doctors for outpatient regular medical visits. And then this year they were going to cut 8%, and I think it got negotiated down to 3.5%.
2%
So
is what I saw.
I think 2% is the pay go, but then there was still the other adjustment.
Oh my
They
goodness,
they improved it, but it's still a big
a
cut.
loss.
And the interesting thing was I was reading this article, and they said if you eliminated all outpatient payments to doctors for every surgery you do, Tom, for every patient I see, for every patient Chris sees, that would save 10% of Medicare cost. So 90% of Medicare costs would still exist because it's going to the hospitals. And so it's very interesting because the hospitals actually got a pay increase this year and the
Right.
doctors got cut. And so there's a lot of questions about lobbyists and the politics, and there might be a lot of complaining on this show. I don't know. Maybe Lewis is an upbeat guy, so hopefully he can kind of guide us and also give us some glimmers of hope, especially with what they're doing at Curo and other health sharing ministries. It's so exciting because it's an alternative to the rat race and the craziness that is health insurance.
Just like direct primary care, that was a fascinating one. Also, to have the patient pay the doctor. What the novel concept. Well, with that introduction, we will have Lewis on shortly. But first, the medical trivia question of the day. And since we're talking about wellness, the category is physical activity in Americans. According to a 2021 article called Historical Body Temperature Records as a Population Level Thermometer of Physical Activity in the United States. In other words, they went back and they have a record of people's typical temperatures 200 years ago. They can what's the word? Extrapolate. That's a good word. They can extrapolate probably what their physical activity was. So based on that study, since 1820, how much more physical activity did Americans get or less? Did they get A, 30 minutes more daily now? B, do we get an hour or 60 minutes more of daily physical activity now than 200 years ago? C, do we get 30 minutes less of activity now compared to 200 years ago? Or do we get 60 minutes less a day than then? Or has there been no change in 200 years? How is the average American's level of physical activity, walking or more, changed in the last 200 years? You'll have to wait till the end of the show, but we'll be back after the break with Lewis Brown here on Dr. Doctor. Welcome back to our special interview today on Dr. Doctor with Lewis Brown. He's going to talk about health insurance, health sharing, and wellness. He's the executive director of the Christ Medicus Foundation and has been for the last 9 years. He took off a year and a half to work for the Department of Health and Human Services Office of Civil Rights, but returned to the private sphere again in early 2019 to CMF Curo. He's got a bachelor's degree in political economy from Michigan State University, a law degree from Howard University in Washington, D.C. He's worked for a Republican congressman, a Democratic senator, and the Maryland Catholic Conference. And welcome back, Lewis Brown, to Dr. Doctor.
Thanks, Dr. Mullally. Really appreciate the opportunity.
Sure. And Tom and Andrew would be fine on
Right.
the show. We're all friends here, Lewis. So the cost of health insurance is rising exponentially, but it seems like the services being covered keep decreasing. How did we get here? How did health insurance become such a money pit with so much
Yeah,
friction in the
my
gears?
sense from my experience working on this in government at the policy level, working with Catholic healthcare entities that are really seeking to serve and treat the human person and to place love at the center, is that sometime over the last 60 years, particularly after World War II, when we moved into a health insurance system so based on receiving uh, health insurance, paying for one's medical costs through one's employer, we saw a move away from the patient, the person at the center of our healthcare system and the relationship with God. And we moved that to it being focused on profit. Uh, and I think that's what we've seen. It the secularization of medicine, the profit motive coming to the forefront of the healthcare system, and away from it being about the patient and their relationship with the doctor.
So, were other countries not offering health care through employers back after World War II? Was this
I think
something
it
new in the
was it
world?
was my experience. It's newish, and some of my experience on this and understanding of it when it comes to other countries is not the same as when it comes to the United States. But when you saw other countries, particularly in the West, particularly when you're looking at Europe, increasingly, particularly post-war, they started dealing with paying for the healthcare cost of their citizenry through government health plans. We first focused on the private sector through the employer, but increasingly that pulled more and more power, influence, and appropriate exercise of control away from the patient and into a healthcare system that was much more focused again on profit and finance, and away from what it should be about, which is caring for the human person.
It seems crazy. You know, I in preparation for this show, I was looking up, Googling Dr. Google a few things, and they said to have a baby, the first Blue Cross baby was in 1933. I was reading they were in the hospital for 10 days, and it cost $60 to have a baby. Now I just had a baby not too long ago. It was more than $60. Um, and so you got to wonder if this is so great, uh, why don't people love it? And if it's so great, why don't we do this with everything? Why don't we do it with food? Or why is auto insurance and life insurance different? What makes the health insurance machine so different? Is this historical, or does it have to be this way?
I don't think it's historical. I think, again, people saw that they could make a buck. I think there's a mixed motive of desire to help and care for people, and also desire to make a buck. And that's appropriate, right? People have to pay, they have to pay to live for themselves and their families. It's understandable that would happen. But at some point, it moved away again from how do I care for the patient? It moved away from the doctor that was going around serving the patients that they could serve within their community, and it's become something else entirely. And so I think there's a need to reclaim healthcare for what it should be about: caring for the sick and suffering, helping human beings flourish as children of God that they were created to be. And I think that's the challenge that's before us today. The opportunity to reclaim healthcare, recenter it in its proper foundation, could create an extraordinary renaissance in our American civil society. But if we fail to do it, the consequences are dire.
So, how can Andrew and I do that? For instance, we just found out we got a 3.5% pay cut this year from Medicare. Yet I know in our practice, we have increased wages 15 to 22% in the last year to year and a half. And that's the money we get to do it with. 80% of my patients are Medicare. You know, after a while, it's not going to be sustainable. What is a way out for physicians and for
I've seen a
patients?
couple things that work, and I have some experience here, but in some ways, my expertise is has some limitation. But I've seen a couple things that I think have the potential to flourish. The first thing is for some physicians, particularly that are doing primary care, And obviously, most doctors aren't doing primary care. But the power of a direct care practice. I'm a member of a direct care practice that
Yeah.
is doing extraordinary work in Northern Virginia. I can out my wonderful doctor, Dr. Matt Hayden, who's outstanding. And it has, on a certain level, in terms of how I engage my healthcare and my overall fitness, it's really changed my life the last 5 or 6 years. It's been extraordinary. So I think the power of a direct care practice where there's less management that the physician has to be in. They can spend more time with the patient. It's more of a direct relationship. I think financially, it can be extraordinarily uh, financially beneficial to the physician. Uh, I had a health expert who we collaborate with at the Heritage Foundation said to us several years ago that even a few years ago there was over 2,500 direct care practices in the United States, even one in the Ozark Mountains in Arkansas. And that's not to pick on Arkansas, but it just shows you that it's really penetrated across the country. So I think there's power in direct care practices. I also think there is an opportunity for more and more physicians to collaborate together, particularly those that are faith based and those that want to practice ethical medicine. And there's power in, our friends at Catholic Benefits Association say there's power in association. I think that's true with large independent physician practices banding together to practice medicine the way it's supposed to be practiced, putting the patient at the center, recognizing that their spiritual relationship is the center of everything.
Lewis, it sounds like as you're describing these direct care practices, I mean, that sounds like how it used to be. And, we've on the show, we've had
Yeah.
folks who are practicing in that way.
Yeah. Marguerite
And
Duane recently.
we aired that not too long ago. And it's awesome. It sounds great. What got us to this point where we're trying to look back to that? What's changed about health insurance in the last 50
I think
years?
there's a couple things. I did think about this a bit. I think a couple things. I think the big shift, particularly the last 11, 12 years, has been the engagement of the government. On a certain level, um, there can be benefits for government being engaged, kicking out bad actors when it comes to health insurance companies, regulating the healthcare industry to protect consumers that are buying various healthcare products, also to protect patients from abuse, waste, and fraud at the hands of their medical professional providing them care or the healthcare system that gets overly focused on the profit motive. At the same time, though, government engagement in healthcare it has an appropriate place, but it can overreach, it can overextend, and when government gets in the business of creating the market of in healthcare, managing the market in healthcare, and on a certain level running the market in healthcare, it doesn't work and it creates a bad proposition. I think both for medical professionals that want to be in the ministry of caring for the sick and the suffering, but it's also a bad proposition for the patients. We've seen just an increase in cost, an increase in disengagement on the part of patients who feel like their physician doesn't know their name, doesn't know anything about them, is only spending 7 minutes. We also see increasingly practices saying we're not going to take Medicaid patients, we just can't afford it. And that's a problem. And so I think having greater engagement at the local level, at the level of the family, the church, the community, and individuals coming together to provide care in their local communities and at the state level, that's the way to go. It's simple subsidiarity. It's very simple, but it's also very complex. But I think moving away from a centrally controlled government system is a large part of the solution going forward.
So let's talk vocabulary. I know Chris Stroud likes to get down to basics. So what's in with health insurance? What's a
Uh,
copay,
a
Lewis?
health insurance copay is where, usually, particularly with an employer sponsored plan, where the patient or the consumer is putting some money, some amount of money to pay for their medical bills. And most people experience that depending on their health insurance product.
And then a deductible. How is that different than a copay, or is copay part
The,
of the
the
deductible?
deductible is usually what's paid. The very initial that the patient has to, or the consumer, the patient and the consumer has to pay usually before insurance kicks in.
Okay, so the copay can go toward that deductible, and that's usually a number that's for a year for a person or
That's
for
right.
a family. Is that right? Okay. What is
I Co-insurance is
co-insurance?
complicated and out of a little bit out of my purview. We've dealt with that before, but
Okay.
probably a little bit beyond my expertise. I wouldn't want to lead listeners astray.
We see it a lot in primary care, the coinsurance. It's a lot of times it's where you've already kind of met your deductible amount, but there's a sneaky thing they call the out of pocket max, which is like the maximum you can pay before the insurance pays for everything. And so after you meet that initial deductible, you got to pay a percentage until you get to that out of pocket max, which is it's just another mechanism, I think, to try and get the patients to pay for the care.
And of course, then there's the out of network
Right. So
coverage.
that's
What is
coverage
that,
that
Lewis?
with an insurance plan that'll kick in when a person has a provider network that has some type of relationship with the insurance plan. And if someone decides to go outside of that network, it might kick in that there's some additional cost for going outside of some type of preferred network that an insurance plan has set up in advance of the person joining the insurance plan.
And then there's the highly unfavorable phrase prior authorization.
Sure. I think generally that deals with where the insurance company authorizes or doesn't authorize certain type of medical procedures to be paid for.
Is your blood pressure going up, Tom?
Mine is
Mine's like, ugh.
just one more definition from Lewis, and then I want him to compare health sharing to all these different terms. And then the single payer
Sure.
plan.
It's interesting, Tom. This Tom and Andrew. It's so funny because I have written about, talked about, worked on healthcare policy a lot at numerous levels the last 10 years or so, and trying to figure out the best way to message this. But when we talk about a single payer, we're talking about government controlled healthcare, where the federal government in Washington, D.C., the Department of Health and Human Services, is running, maybe it's multiple programs, but essentially centrally planning, centrally controlling, centrally running our nation's healthcare system. I would have said 4 years ago, before COVID, before the public health crisis, that we hadn't yet reached a government controlled healthcare system. That there's still a free flowing private market, that there's a place for faith and the family, that there's a place for uh, medical professionals of faith, religious sisters to band together and to provide care. And there is very much a place for that, for private individuals, for people of faith, for religious organizations to provide care. Unfortunately, I think what we've seen the last 3 years is while we don't have a single payer system where there's one federal program for 300 million people to provide to receive the coverage of their healthcare costs, the payment of the healthcare costs through one system. We don't have a single payer system yet, but we do have, on a certain level, government controlled, government run healthcare, where the federal government, I believe, exercises outsized, disproportionate power and control over our nation's healthcare system. There's some benefit to that when it comes to certain aspects, but overall, it's a net negative. It's something that needs to change.
What
So,
with the single player plan too, I mean, it looks to me, Lewis, like almost every couple of years the federal government seems to be getting closer to a single payer plan. Just by biting off different percentages of the population that ultimately end up on Medicare or Medicaid or another program like that. Is that fair to say that they're kind of nickel and diming their way
Right, and
to
I
a
think
single
I
payer
think that's
plan?
what we're seeing, and there's a lot of debate about whether that's intentional or not. There's some that would say, and I'm not saying this, but I'm saying that these are some of the arguments that are out there. There are some that said that when Congress and policy experts passed the Patient Protection and Affordable Care Act, the ACA, otherwise known as folks will call it Obamacare, but the Affordable Care Act was passed. That was built in essentially not to work and to therefore require an ongoing expansion of the state and federal health care exchanges to garble up more and more of the patient consumer population in the United States. Some people disagree with that, but I think that's what we're seeing. So, by way of example, without getting too detailed, uh, post the initial outbreak of COVID, there was a massive expansion of the funding of the cost of premiums for millions of Americans to provide more federal tax support for the payment of those premiums, basically making it more attractive, incentivizing millions more Americans to join the exchanges, the healthcare exchanges, the health insurance plans that were created by the Affordable Care Act. And there was a refusal to roll that back now that the public health care crisis is really calmed down. So I do think, Andrew, that you're right, and I think it's very bad. It's not good. I mean, it's good that we're helping people, but there's a right way and there's a wrong way, and I could go into great detail on that. But yeah,
Do 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 you think patients see this? Do you think patients see this as bad, or do you think they, I'm thinking kind of as a devil's advocate, hey, now I'm on this program. It's a lot
Mhm.
cheaper than it was before. Maybe the single payer thing's a good thing. Obviously, a lot of political folks want to do it. Tell us how to think through that, or why maybe a patient might recognize this is
Right.
not
So
not best for
I think
me.
there's a couple ways of looking at it. I think on the upside, what are the positives of the extended government support that's enabling more Americans to pay, to pay less, to have health insurance plans that are more affordable to them through the exchanges. What are the upside? The upside is that, and this is real. There are people that are able to. There are some people that are more easily able to pay for some of their medical cost in ways that they weren't able to do before. There are people that are able to save money and have the safety and security of feeling that there's a health insurance plan that's essentially backed by the federal government that's going to be there to pay for some of their costs. And so whether that's the veracity of that's debated, but there's some truth to there, and I have no doubt that there are circumstances where that's a very serious real benefit that's important, and there's a role for the government to provide for the social safety net. I think the negative. Go ahead, please.
Oh, no, Lewis, I think this
Sure.
is a good place to take a break so that when we come back, we can then talk about what are some of the things that health sharing, like Curo's doing, and wellness in the face of what seems like this gargantuan system. What can we do at the local level to take charge of our own healthcare? And we're going to do that with Lewis Brown here on Dr. Doctor after the break.
And we are back with Dr. Doctor today talking to Lewis Brown about health insurance, the disease, I would say. It seems like we have a pandemic in the health insurance marketplace, and we were talking about that. And hopefully now we're going to be talking about the antidote as well. Lewis, right before we went to break, we were touching on the single payer system, which depending the circles you run in, some people look at that as the grim reaper, or really the final enthalpy of all health insurance is it all goes over to the federal government. You had mentioned some of the good things. Admittedly, it would be beneficial in some ways. Tell us why so many people are afraid of that and why we are looking for
Yeah,
antidotes
I
to this
think
problem.
and particularly thinking about this as Catholics, I think the challenge with the single payer system is twofold. The first is that it undermines the principle of subsidiarity. Problems are best uh, solved when you're closest to the problem. Judy in California can't get to Susie in Detroit and love her when she's in crisis, as well as Jimmy, who's down the street, who can be right there with her. And so, in a similar vein, when we have the family, the church, the local community, the state that's most engaged with problems that are closest to the problem, you have better solutions. And so, when you think about a single payer system where where you have a centrally planned system from Washington D.C. essentially running the entire healthcare industry for 300 million people, massive problems are going to incur. And the experiment with the Affordable Care Act has shown us exactly that it's not really working. It's being financially propped up, and patients are unhappy. The other challenge is a single payer system in a world where there is extraordinary respect and protection of the sanctity of human life and human dignity from conception to natural death within the biological scientific reality of the human person. A system that's single payer and that type of cultural reality, consistent with life, dignity, and the human person, is, perhaps is something to consider. But that's not the reality that we live in. We live in a world where there's extraordinary hostility for the dignity of the human person, for their sexual, biological, chemical reality of their existence. And really, I think in the world that we live in, what we are seeing is by the control of the federal government of the healthcare system, you're seeing it becoming an increasingly a delivery mechanism for the culture of death in our healthcare. That's why it's so dangerous.
Lewis, tell us about the antidote. Obviously, in your work, you do a lot of things, but with CMF Cure, one of the things you guys have, you're obviously our sponsors, is this health sharing product. What is health sharing, and
Sure,
how can that be
I
an
would say
antidote
that
to this?
Christ is the anecdote, and that's not to be trite. That's not to be, to have a nice soundbite, but that's the reality. Every answer is Jesus Christ. Every answer. And so, how do we understand that? What Christ teaches us is to be in communion with Him and to be in communion with each other. And that's what health sharing, but also the work that we're doing at the Christ Medicus Foundation, particularly through our Curo ministry, is to bring thousands of Catholics across the country into greater communion with Christ and each other through the sharing of medical costs, but also through providing them with our expanded services that include spiritual direction, Catholic healthcare coaching, online wellness courses steeped in the Christian human anthropology of who we are as human beings created in the existence and the dignity of God. That's what we're doing. Something to share with you, you might be familiar with this. There was a Harvard study that's very famous that looked at lifespan and longevity and the factors that most greatly contributed to the longevity. They started with the class of 1938. I've spoken about this in different venues. That class
Oh,
included Jack
yes.
Kennedy, future president. It also included Ben Bradley, who was the executive editor of the Washington Post. And looking over 60 plus years of what was the difference in why those folks lived longer and some folks lived not as long. The main difference, it wasn't diet, nutrition, all of these other things, the level of one's healthcare. It was community. It was meaningful relationships. And the number
Mm.
one person to have a relationship with is Jesus Christ. The number two person to have a relationship is all of the people around you. And so that's what we're doing at Christ Medicus. We're helping people share their medical costs, but it's much more than health sharing. Health sharing is great, it has its place. But we're providing services that are helping folks encounter Christ in every dimension of their health and wellness. It's whole person wellness through the Catholic health coaching, through our online services, through our spiritual direction, and also through a spiritual health program, in part based on the great work of Dr. Bob Schutz at the John Paul II Healing Center.
I just wanted to say, you stole the next words out of my mouth, Lewis. In other words, any of the benefit that people are getting by listening to Doctor, some of that is definitely due to your generosity to us so that we can continue to do that and pay the costs of putting this together. But also, you have introduced us to Bob Schutz, who is giving us a new level of understanding of what healing is, and that truly it is. If you come closer to Jesus Christ, so many things, even physically and mentally, do get healed. Not everything, but life definitely gets better. So I think you are so wise in doing that. Now, I wanted to ask you, Lewis, with just the health sharing part of it, before we go on to some of the wellness things you're doing, how does the health sharing help with the costs of seeing a physician, of having
Sure. So,
surgery?
we gave a presentation to a group of Catholic men yesterday, and we were greeted by one of our members who had a significant healthcare event in their lives, and it was hundreds of $1,000s. It was paid in full, and so our members that join our ministry of Curo um, have their medical needs once there is a medical incident, they have their medical cost paid for by the membership that's nationwide. We partner with Samaritan Ministries International, and they're a large Christian health sharing ministry with over 100,000 um, uh, Catholics, Protestants, Christians of various denominations that all believe in the Trinitarian Father, Son, and Holy Spirit that are sharing their medical costs together. And I think that it is not only a wellspring of confidence and security that medical costs are going to be paid for, but it's also a real expression of the a body of Christ coming together to directly care for the medical cost of individuals across the country.
So, would you say that patients have a more direct line to their physician when they're being paid like this versus through health insurance? I mean, do they have to worry about copays, deductibles, out of network coverage
No,
with
those
health
things
sharing?
it's very different. Health sharing just is not insurance. It's so different. And I think one of the main ways is that within our model, a individual, a family will pay the first several $100s, few $100s of the medical bill, but the rest of it is shared out to the membership. There's no middleman. The patient is interacting directly with their physician, with the medical office, or with the hospital that they're working with. But it cuts out the middleman. It really puts the patient, the member of our ministry, in the driver's seat when it comes to their healthcare.
So, there's no need for catastrophic insurance
There,
with a health
there's it
sharing plan.
without getting too into the details. There's different ways of doing it, and but generally speaking, even very large health insurance cost, excuse me, even with very large uh, health incidents have extraordinarily high
Care
cost,
costs. Yes.
that can be shared through the membership, and we're seeing that happen with members over the years that have had significant life altering catastrophic incidents and having their medical bills paid in full. There's different levels of the sharing that one can join to provide for that. Some people may choose to still have a catastrophic insurance plan on top of it, but I think generally for most people that's not necessary.
How would that dovetail with one of the direct primary care practices? Do
Um,
you guys work
we
with
don't
them?
work with any practice directly in terms of some type of formal engagement, but I can speak to just my own experience as someone that relies solely on health sharing, but also
Yeah.
has is a member of a direct care practice where I pay around $70 a month to be able to see my physician. Um, Health sharing through Curo, it doesn't pay for preventative costs. That's all on the member, but it pays for costs that come from an actual medical incident where someone gets ill or has an injury or something to that effect. But the preventative care is on the person. So with my direct care membership, I'm a member of Modern Mobile Medicine in Northern Virginia. I'm generally able to see my outstanding physician, Dr. Hayden, within 24, 48 hours. I'm in the office with him sometimes same day. Usually, I said generally, if I have an issue in the morning, I can see him that afternoon. Definitely, usually the next day, I can be on the phone with him within hours. It's extraordinary, and I think that kind of relationship, he spends time with me as opposed to the I think the disappointment and the sense of being lost, unseen, kind of forgotten with the normal visit with the primary care doctor that lasts 7 minutes and they don't even remember your name and know nothing about you. Dr. Hayden knows, when it comes to my healthcare, virtually everything about me, and that is able to increase the his capacity and the quality of his care for me. And I've seen that over and over and over and over again. So I think with a direct care practice merges very well with someone that seeks to do health sharing.
So, Lewis, in the last 9 minutes, let's go through some of the health and wellness things. What would you say is the number one wellness thing that you offer that has been demonstrated to really make a difference in
I've seen
patients'
spiritual
lives?
direction. Now, it may not be best to characterize it as health and wellness, although we do. It's part of the whole person and their human flourishing. Saint Irenaeus said that the glory of God is man fully alive, and that's man fully alive through relationship with Jesus Christ. But that the power of having access to a spiritual director is extraordinary, and we've seen. We have a deacon who's been public about this. His life was transformed. At least his vocation to the diaconate was transformed as a wonderful deacon Sandin out in Anchorage, Alaska, in that area. The spiritual direction really helped him to come into the fullness of his vocation as a deacon, and I think has probably altered his life for the positive. We've also seen we our members have done a Bible study, or excuse me, not a Bible study, but a member study on Be Healed and walking them through that. We've seen extraordinary power with that. We've also seen real power with our Catholic health coaching. We have a great, remarkable Catholic health coach, Rebecca Wilson, graduate of Benedictine College and also graduate school out in Austria. And she has been working to improve the wellness, the physical, uh, wellness of our members. And part of working with that, what Rebecca has seen is it helps people to break through barriers and lies they might be believing about what they can and can't do with their health. So those three things combined, I think that the power of the spiritual direction, people having a health coach where they have a relationship with someone centered in the Lord that's checking up on them, helping them set goals, encouraging to advance in the reality that their body is a temple of the Holy Spirit and should be treated as such. That has been transformative um, for for some of our members that are doing the programs, and it's been a wonderful thing to see.
What does a health
I'm
coaching
not a health
session look
coach, and we
like,
should have
Lewis?
Rebecca Wilson come on to talk about that. But I think, yeah,
Not a
I
That's
think
bad
good.
generally
idea.
they set goals. She first of all, what she does is she really gets to know the person, and just spends time with them. It's remote, but gets to spend time with them and see where they're at in their life, and gets to know them better. And I think over time they set a plan, set goals. I'd rather let Rebecca speak to the details of that, as I am not a certified health coach. But it's been a beautiful thing to see Rebecca get it off the ground and also to see the response from our members.
Yeah, tell us some more of the stories about kind of success stories and what the members have availed themselves to with
Yeah,
these
I
wellness
think I
programs.
think the big thing that I've seen across the board, just in talking with our team and reading some of the testimonials and seeing we have a few video testimonials from some of our members, and we just launched this in November. Some of this was going on. We've been doing some of these services a little bit before. Um, with what we saw with the public health crisis is that people were separated from being the incarnate beings they were made to be and being with God in community in person. Um, and people were separated from family and community. And you see just this social disintegration happening directly because of the public health crisis. Some of that may have been avoidable. Some of it may have been necessary at different times, and not getting into that debate. But it has created a sense within many within our country. We see this with college students, with young adults, with older adults, of isolation, of being disconnected. And so I think the main thing through these programs is helping people to reclaim their identity as sons or daughters of God in every facet of their life, reclaiming their dignity through being connected and in communion with others, and even just knowing that someone is checking on them, cares about them, and is inspiring them to do the will of God, even in their healthcare, to treat their bodies as temples of the Holy Spirit, to know that the Lord has a plan for them, and that they are good, as Rebecca says. That has been, I think, the biggest impact of the work that we're doing. This isn't a business; it's a ministry, and our ultimate goal is that people know that they were made for love, that God loves them, and God wants to get them back to Himself, and that's what we're in the business of doing uh, through healthcare.
Yeah,
So
it's so interesting because that when people go to the hospital now, I don't know that that's what they walk away with. You know, maybe 100 years ago when it was all nuns, and a lot of times, I mean, some of the hospitals were charity based or pay what you can, that type of thing, and that's been totally lost. So it's beautiful to hear that you guys are bringing that back, and it does sound like an antidote to the depersonalization that we're seeing. What do you see in the next 10, 15 years of the healthcare game? Is health sharing going to take over, or is it going to be
I
single
think
payer? What's the deal?
it's a real battle. Um, the weapon for us as Christians is always prayer and acts of spiritual, the spiritual and corporal works of mercy, right? That's the weapon for us. But it's going to be a real battle. And, I'm hopeful because we know that Christ wins in the end. Right now, without um, a lot of prayer, reparation, and those spiritual and corporal works of mercy, a we're headed for the potential of a government healthcare system where the culture of death is normalized throughout healthcare. That Catholic healthcare is shut down and pushed out of healthcare altogether. That pro-life healthcare providers are put out of healthcare altogether, and things like abortion and contraception and transgender procedures become not only um, uh, you know permissible but required and coerced upon patients and providers, even things like sterilization and assisted suicide. But I think with the grace of Almighty God, with a lot of prayer and petition, and with a lot of works of acts of spiritual works of mercy, and the corporal works of mercy, we can reclaim healthcare for Christ. And that looks like going out to the margins with the best care that we possibly can on the medical side, on the technological side, and psychological counseling, prayer ministry, all together, presenting the divine physician, expanding the reach of the divine physician in medical clinics, in Catholic hospitals, not retreating, but going further out. That's a lot of the work we can talk about another time that the Christ Medicus Foundation is doing. We're launching the Heart of Christ Clinic here in Detroit with partners, a new medical center in Detroit that will provide for pregnant mothers and their children and the whole family that we think will become the best primary care in the city of Detroit and in the region of Metro Detroit. So that's the kind of work I would like to see us as a church do across the country, that we're caring for every pregnant mother, not just the work of a pregnancy clinic or pregnancy resource center, but all of the work of a primary care that one would get for the whole family that provides that medical care, but also transforms their lives by bringing them into the community, into the womb of the Blessed Mother, so that they're cared for, healed, and loved.
Lewis, that is a beautiful comment to end on for this episode. We're going to have to look on about having your health coach on. That sounds like a fascinating topic. But thanks for being with us for another episode of Dr. Doctor.
Thank
and we
you
hope
so
to talk
much,
to you again, Lewis.
Tom and Andrew, I should say. It's a pleasure.
God bless you.
And we are back with Dr. Doctor and the answer to the medical trivia question. Tom?
So, compared to 200 years ago, how much more or less exercise, physical activity do Americans get? 30 minutes more, 60 minutes more, 30 minutes less, 60 minutes less, or the same? And the answer is we get 30 minutes of physical activity less now than 200 years ago. And
I
I
was
am not
gonna
a bit
say less for
surprised.
sure. Yeah. That's I'm glad it's only 30 minutes less. You know, you always think of these old dead people. They were working constantly. And I'm like, oh, 30 minutes more. Okay, that's not too bad.
Yeah, that is amazing. But it is what it is. So, do we have a top
1820
three?
wasn't that bad.
Yes.
Yeah, we do. I love talking to Lewis. A couple of things he said stood out to me. We were talking, and I love to complain about health insurance. It's part of just the joys of being in medicine. He kind of diagnosed the pathology as a lack of subsidiarity,
Yes.
which I like it when he brings that out. Obviously, a pillar of the kind of social justice of the church, and I think that is it. You know, that's point number one. Point number two, the the quote that came to me as he was talking is from Mother Teresa, and she said that, we've forgotten that we were made for each other. As
Oh,
he's
great quote.
talking about going to the periphery, he's talking about providing health care, but in a local way from someone down the street, being with them, suffering with someone rather than straight bureaucracy. And he had mentioned, the profit motive and growth and centralization. And that's not really where people encounter Christ, and that's not the best way of doing healthcare for sure. And then for number three, he had mentioned at the end there, especially the culture of death versus the culture of life. We hear about that on TV, read about it in the paper all the time, and the risks in healthcare, of which there are many. But the alternative, the antidote is to have life and to have it abundantly, is what Christ calls us to. And I think Lewis is on the forefront of that. So I am excited to hear more in the future from him. I love the idea of the health coach, and also excited to hear about his work with Steve White and the new healthcare initiative that they're doing. So hopefully we'll be touching base with them in the future on that as well.
Yes, so we like getting big picture. We like getting narrowed down into different diseases. So we're trying to cover it all for you here on Dr. Doctor. I always enjoy seeing the gamut of medicine, and we hope you do too. But we really want to know what you think once in a while, and we're going to tell you how to do that here on Dr. Doctor, because otherwise it's just our little circle around us telling us what we think is important, and it's mostly Chris, Andrew, Andrea, and me.
That's true. We love good ideas. We don't have any corner on good ideas. So if you have a good idea, write us and tell us, and we will steal it and maybe give you credit.
So thanks for being with us for yet another episode of Dr. Doctor. You can listen to this episode and all on our website, drdoctor.org. If you click on episode archive at the top right, you can search over 300 episodes by guest or topic.
And we now offer a video version of our podcast. Just click on the YouTube link near the top of the homepage at drdoctor.org. And if you have a question or, like I said, a good idea, click where it says submit a question. We'd love your input.
Yes, this is Dr. Tom McGovern
and Dr. Andrew Mullally, and we're signing off until your next dose of Dr. Doctor.